If you want breasts at a later point in your life, you can go and get them.
She said, if you want breasts later in life, you can just go and get them. Is that correct? Can you just get a new organ?
I thought, I'm never gonna use those organs. I never planned on having children, you know, like, I might as well just get rid of them and I'm gonna feel so much better.
I honestly don't think I was at an age where I was able to fully, like, truly understand.
Girls in the United States as young as 13 and 14 years old are having mastectomies of completely healthy breasts.
In terms of masculinizing top surgery, I think 12 is the youngest who's had surgery through our program.
Top surgery is for transmasculine patients who have significant dysphoria related to their breasts.
So these are the drains, and they hook onto your bandages. Today's the day that I get the bandages off. They are so tight that it's the worst thing about recovery, in my opinion, is how tight the bandages are. The drains on the side dig into your sides. I feel like I have like cuts.
The biggest contributor to the guilt for me is looking back and seeing that I got that surgery because I hated a part of myself so much.
I had top surgery. It was a month before I turned 17.
This is what my chest looked like only a few days after surgery. My nipple was not looking so great. She tore out all the dead tissue, which there was quite a bit of. You know, we had like napkins full of blood and pus. She massaged down my chest towards the opening and blood just flowed out. Here it is 3 days after all of that stuff happened. You can see my nipple looks like a cavern.
I had this intense grief. I was so angry at myself for having made this decision, and I was angry at the doctors for having let me.
A phalloplasty is about creating a penis. So we take tissue either from the forearm or from the leg, or sometimes both, and transplant it down to the groin area to create a phallus.
Well, as you can see here, my right thigh was the donor site, and this scar on my left leg is from the skin graft covering the donor site.
After my phalloplasty surgery, I've been dealing with some complications with urinating. I wasn't able to urinate at all. It was really scary. It was extremely painful.
When we do a orchiectomy, we make a cut right there and right there, and then physically remove the testicles.
I was really surprised to be approved for orchiectomy. When I woke up in the morning, I noticed very sharp pain at the bottom of my incision site. Immediately after surgery, I was in excruciating pain.
What is gender-affirming vaginoplasty? It is a trans-feminizing male-to-female procedure using the natal male genitalia to create a vagina. Infertility is a result of the surgery itself.
The worst thing that can happen after this surgery is what we call a fistula. If a hole forms in the rectum, oftentimes the stool will, instead of going out the way it should, out the rectum, it will instead leak out the new vagina. Many times we have to do what's called a diverting colostomy. So what that means is the patient has to wear a temporary bag on their belly where they have bowel movements. Patients need to be very aware of it before signing up for the surgery, that this is indeed a possibility.
Went through 2 surgeries to change my genitalia. I had excessive bleeding, and coming out of surgery, I was bleeding, and it was actually inside the new vagina pocket that was just created. They were packing in gauze and gauze and gauze, and actually had to put sandbags on my abdomen to try to create the pressure to stop the bleeding. And then I had to have blood transfusion, a lot of plasma.
The hard part isn't over after the surgery day. It's really just beginning.
What we know is that even hormonally and surgically treated trans identities exhibit high levels of suicide ideation. Individuals with gender dysphoria are well known to commit suicide at elevated rates. But this is true both before and after social transition, and before and after gender-conforming surgery.
People are okay for about 10 years after these surgeries, but then after that, then this great regret and even death from suicide begins to occur.
I made a really dangerous choice that I have to live with. I have to live with this for the rest of my life. And it terrifies me.